So a lot of parents ask me this question, how do I manage fever at home? And is it safe? So a few things for us to know. If your child is less than 3 months, definitely it is not safe to manage at home. So I wouldn't recommend that. But any child who is slightly older, so 6 months and above, and definitely 2 years and above, you can manage fever at home. So what are the few measures that you can do? Make sure that your child is wearing simple light clothes, is not heavily layered. Definitely no sweater and all of these warm woolen blankets to wrap the child with. So make sure that the child is nicely aerated. You hydrate the child well, regularly, frequently, and make sure that your child is passing enough amounts of urine. If necessary, you can put the fan on. You can put your AC on, it's absolutely fine. You can use tepid sponging, so you may use normal temperature water and then sponge the baby down. You can recheck the temperature, and there are medications which are doctor prescribed, and that is what we recommend based on your child's weight. So based on their weight, whatever the medications are, the commonly used ones are paracetamol, and sometimes if the temperature is very high, we do prescribe ibuprofen. So these are like some of the medications. If your child is not able to take by mouth and is refusing, then you may want to consider medications that can be given in the bumtal, what we call as suppositories. So these medications are strictly doctor prescribed, and I wouldn't recommend any over-the-counter prescriptions. It is possible that your child can get fever frequently. Now you may think that you've given this medication and it has come back again, and I have a lot of parents coming back to us to say, in the last 4 hours the child had this fever, we gave the medications, it's come back again, and so that's a worry. So it is possible most of the time, due to viral illnesses, fever can recur. So in a day you may get fever spikes 3 to 4 times a day. So you can continue the same measures every 4 to 6 hours as long as the fever returns to baseline, that means less than 100, and your child is active and is able to take fluids in between. So and you can manage such children at home for the first couple of days. If your child is having any warning signs, then you may need to come to the hospital. I've heard parents actually telling me, my child has got a temperature of 104, and so they rush without even giving any basic measures as what I discussed. So it doesn't matter what your child's temperature is, as long as they respond to treatment. So I would seriously recommend, no matter how high the child's temperature is, to follow these basic measures initially, see the response, and then it is possible that your child may get a temperature of 104 at least 3 to 4 times in a day. But the key thing is your child well with it? Is your child able to take down the fluids and keep down the medications and respond to the fever control measures? That is the key thing. So temperature alone, a high temperature alone is not a medical emergency. So now, what is a medical emergency with fever? If your child is not able to keep down fluids, not responding to medications, becomes drowsy, is less active, is passing less amounts of urine, is having a headache, is lying down in a corner, not able to see the light, is coming up with a rash that looks like, getting worse over the day. If your child is passing frequent urine also, or is crying with pain, because whenever they pass urine, they have tummy pain, there is repeated vomiting, there's loose stools more than 5 times in a day, then it is worthwhile coming to the hospital for a clinical review. At Aster RV Hospital, we are committed to the care of children in our outpatient department, in our emergency department, which is child friendly, and an extended service in case your child is seriously ill in our pediatric intensive care unit.